like to introduce Dr. Bernadette Riley. She's currently the director of the New York Institute of Technology's Ehlers-Danlos Syndrome Hypermobility Treatment Center and a professor of family medicine at the New York Tech College of Osteopathic Medicine. She's a graduate of Fordham University and New York College of Osteopathic Medicine. She has a special interest in treating the hypermobile patient. In her current role, she directs a multidisciplinary center and is involved in a variety of research projects, presentations, teaching, publications, and grants at the center. Dr. Riley is interested in nutrition as a treatment option for the hypermobile patient and graduated with her Master of Science in Clinical Nutrition with distinction. She also has an interest in health policy. In 2017, Dr. Riley achieved an academic qualification in international medicine and public health from the Institute for International Medicine. She teaches advocacy to the medical students and wrote the curriculum for and is director of the fourth-year Congressional Health Policy Elective. She served 2 years as president of the New York State Osteopathic Medical Society and from 2022 to 2024, and is assistant secretary at the Medical Society of the State of New York. She's board certified in family medicine and osteopathic manipulative treatment from the American Board of Osteopathic Family Medicine and American Board of Family Medicine. So with that, I'd like to welcome Dr. Riley. Thank you for being with us today.
Thank you so much, Dr. Moody, for that wonderful introduction. I'm really excited to talk to all the women's physician section and be part of it from the beginning. So I'm excited to get involved. And today I'd like to talk to you about how to get involved in health advocacy. I love this talk because it really is individualized and it really talks about the importance of all the different things that you can do with regards to health advocacy. So our learning objectives today is to understand the importance of getting involved in health advocacy. And I'm really talking to the choir here because I'm just looking at all the names and we have such wonderful advocates already, but maybe this will just enlighten you on some other things and make you more passionate about it. It can also characterize your level of training in the healthcare setting and set goals to help your patients or your personal advocacy goals. So with this, I like to say, especially when we're meeting with members of Congress or other members of government, we are the experts in health advocacy and our healthcare of our patients. Also, I'd like to all provide a way to understand the ways you can get involved in advocacy at all levels of your training. I especially have an interest in the medical students, but in every level, whether you're a resident, an attending, a mid-career physician, realize that you can get involved and have insight into the power you hold. I think it's really important to recognize all that we do and all that we can serve for health advocacy. How do you start? Well, it's really an individualized pathway. One way I like to say is there anything that you feel really passionate about? For example, if you are a clinician seeing patients, is there anything that you see daily, on a daily basis, that you say, you know what, I'd really like to support my patient in this, or I'm really seeing a prevalence of this in my patient population. So maybe perhaps there's something that you're thinking and you're seeing it commonly and you say, you know what, I really want to advocate, or I really want to look into this more. So anything that moves you, that's somewhere that you could start. Another thing, some people, some of my former residents and my former students, they really have passion about scope of practice. And I know that's something that MSNY stands for fully. Physician stressors. A lot of my advocacy comes with my own personal physician stressors and what I deal with on a daily basis. So those are things you could think of and see where you stand. Inpatient, outpatient, whatever medicine you practice, academics, on an undergraduate level, on a graduate level. And then there's, of course, especially for clinicians, but also in the academic world, the fear of malpractice or professionalism complaints or those types of things. So these are just some things that can get you started in regards to what is your individualized plan with regards to that. Finding a passion is important. Think about cases that you've had in the past or experiences. And I always like when I meet with members to talk about a personal experience, or at least, and we'll talk about our elevator pitch, which was one of the things we spoke about in the spring 2025 Women's Physician Leadership Academy, but making it personal and having that personal approach. As I said before, we talked about a mission statement in the Women's Physician Leadership Academy. So I think one of the greatest things is finding your community. And that's why I know so many of, with your chair, and so many of the people in the WPS have really fought to have this community. And I think that's one of the greatest things about health advocacy, because we could all collaborate and we all bring such a wealth of knowledge from not only all of our experiences, but also all that we've been through personally. So if we could all collaborate, make a common goal, mission, and have our own passion, that's a great way to start with health advocacy, not only for ourselves, but also for all the physicians we represent and also all the patients we see. First, you want to see if there's any goals or problems. I like to look at the positive side and say, you know what, instead of calling this a problem, let's see a goal that we can make out of this. So if we see something happening a lot of times, we could say, you know what, this could be our goal. Let's attack this, or let's think of plans that can help with these barriers. Realizing that you're the expert at every level. If you are going to be speaking to members of Congress, or if you're going to be talking about your idea, you have to really research it, be comfortable with it, and then go on. So one of the things that I recommend is finding a mentor. And what's a wonderful thing is the WPS is doing a mentorship program. So if you can find a mentor at any level, like at my level too, I'm always looking for mentors. And just on this call right now, so many female physicians are my mentors that I look up to and want to be like. So if you can see a mentor who's interested in some kind of health advocacy, that would be great to follow them and just to get involved in things. A lot of what I've experienced in my pathway has just been saying yes and being involved in movements or in things that have turned out to be really special for me. Of course, if you're involved in a specialty society, especially in different areas of training, that may be a majority of your life when you're, let's say you're an OBGYN and you're in your fellowship. So that's a huge part of your life. So there are specialty societies, they're national, local, and it's important to realize that health policy, politics, and health advocacy, they're all different. Also recently, one of my colleagues who's also a mentor, who I'm always so impressed with achieving all these goals, have also talked to me about the difference with health and population health, and how that's different too in health advocacy. So in all I do, I'm constantly thinking about too, population health, and just learning the difference, because you don't have to be involved in politics. A lot of people say to me, you know what, I'm not really interested in medical societies or health advocacy because I'm not interested in politics. You know what? The best health policy experts are those who are, not on one side completely, choose not to take a huge stand on one side of the political force, because then there's always that question, okay, when you are talking to different members, just realize that they are looking at where you're coming from. There are so many opportunities to get involved, especially in MSNE, not only the Women's Physician Leadership Academy, which is, a shout out that it's going on in November and December of this year. And it's been for a couple of years now, but also there's things like Advocacy Day. I know the Nassau County Medical Society is doing a legislative breakfast, and that's all virtual options. So those would be great, even if you can join on, if you're part of Nassau County. And that's a great day to meet with leaders, but also to practice your skill. If there's something that you're advocating or you're passionate about, to talk to your leaders. MSNY peer-to-peer, that's always a great support system if you find something, especially if you're experiencing a physician's stressor and you'd like to talk to someone, that's a great way to talk to people, but also to find advocates, or even better, to get involved as a peer and be trained as a peer and do that. I know in our medical school, we started a peer-to-peer. MSNY had come in, the leadership there talked to our students, and then we started our own program where we're basically going through the whole MSNY protocol of the peer-to-peer. So it's a great way to be able to not only be a peer, but also to volunteer your time to help peers. There are these interesting things that are done on the national level, many of which are through the AMA, things like the this medical justice advocacy fellowship. And I will send you the updated PowerPoint with all the links. And this is open. It's until November 2025. And then they're having a new cycle. And this is something you can do. It does require 3 in-person sessions, but this is something that you can do during your time if you're working and you have that availability to take off that time during vacation days or stuff like that, versus other fellowships that we're talking about, like the Robert Will Johnson Fellowship, that would require you to be 100% committed, like stop your years of working or year of working during this time and doing that. So as we'll go into the barriers, that this isn't something, some things you can get involved with at a very limited level, like for example, the Women's Physician Leadership. Those are some Saturdays and Sundays if you could fit it into your schedule, versus if you want to make this a full-time job, there are opportunities. One thing I urge, especially for women, but for all physicians, please look out for each other. Whenever there's an advocacy thing and you can bring someone, especially if it's a student or resident or a fellow, try to bring them, try to give them passion about their power they're holding to help the patients, but also to help each other, and just try to support each other and the network, which is why I'm so happy to be part of the WPS. There are so many opportunities. I know we have Dr. Moody here, just with regards to, and Dr. Rodriguez was talking about beforehand, Northwell, the women's physician section with regards to Northwell, just your department. Sometimes there could be leadership journeys there, and that they could provide opportunities for health advocacy. Being open to invitations from your medical societies, local, state, national, and events, invites for both in person and virtual. So those are some opportunities you could have to express your health policy. So for my story, I really got involved in the osteopathic health policy world as a resident. When I was a medical student, I was always interested in it, but I always took my top priority of studying. That was always so important to me, is studying. So when I became a resident, someone came up to me and told me about something called Training in Policy Studies, which at the time was run by the American Osteopathic Association, where it was, you could do it during your residency. It was self-funded, and you would go down to Washington, D.C. during a Saturday and Sunday, meet with elected officials, but also meet with these wonderful policy advocates, as well as big leaders in the profession, not necessarily only DOs, but also PhDs and advocacy experts. And that really opened my eyes during my residency to the world that was out there. So I am grateful for that time. And that was also learning about writing health policy briefs. And just at that time, that was 2008, which is during the time of like the opioid epidemic, where they added, not before the opioid epidemic that we realized, but they were doing things like the pain. I was assigned a health policy brief with regards to a pain bill in 2008, and it was with regards to pain being the 6th vital sign, how there were medical malpractice complaints if you didn't treat pain. And it's just so interesting, especially when I see my writings from 2007, from 2006, from 2008, to see the unintended consequences of some of those things that happened during that time, and now what we're dealing with. So it's so interesting, and it's something to always remember. I always try to tell my students, especially when they do advocacy on the social network worlds or whatever you write years ago. And I always, one of my hobbies is art. So I was assigned this brief on pain, and who knew that years later I would take care of like a chronic pain population. But I loved seeing Frida Kahlo and her pictures and how she portrayed chronic pain, and she suffered explored extensively about with chronic pain for different reasons. And it was so interesting to me to see that evolution. And at the time, writing those briefs in 2007, we thought these are our panaceas, opioids and treating pain, and all the pharmaceuticals talking about new opioids and stuff, and just seeing the difference and seeing my writing from then to now. So although you do realize, I always say publish or perish, you do have to be careful what you're writing about. But that's the same thing with health advocacy, right? Things that were rules or laws or things that went into effect years ago, perhaps you realize now, okay, there may be some things that are good about this, but there definitely are some barriers as well. So then in 2010, when I graduated from my residency, someone came up to me, really because they didn't want to do it, I think, but they said, do you want to be a national delegate for the AOA, the American Osteopathic House of Delegates? So I said, sure. So that continued with my journey with regards to that, and being a delegate for that, and seeing on a national level the what it was like to be a delegate, and very similar to like the MISNI delegation, the AOA House of Delegates, that's for statewide with regards to, and just seeing the difference in geographic locations. Like, for example, my first delegation, it was very exciting because it was the first time that there was a female president in the AOA. So I got to see her inauguration, which was exciting for me, but also really interesting to see the different geographic locations. For example, like at the time, we were talking about resolutions in gun control, and to see that people like someone wrote a resolution saying they didn't want in hospitals to have physicians walking with guns, and to see like different states talking about their feelings on gun control and how important it was for them for different amendments to have their gun ready. So it's just interesting to see the wide geographic variation and to see other people's opinions. Then I became on the NYSOM's board, and then eventually becoming president of the New York State Osteopathic Medical Society. And just one thing that I've done for many, many years is be involved in their continuing medical education conference, which is a blessing, but also a curse, because no one else seems to want to be chair of it. And it is a challenge every year to do it. And as you know, CME has changed through the years, especially with virtual options and stuff. So, but I still continue to chair that that conference, which we have the Regional Osteopathic Conference every year. And then I got involved in MISNI in 2017, grateful to be involved with regards to that. And that was really with an invitation to be a delegate for NYIT at the House of Delegates, where I got exposed to the Nassau County Medical Society, to which I'm vice president now, the Nassau Academy of Medicine, which I'm really proud of. I'm a board member of that. And we have the chair of the education committee, where we started the Pride in the Profession Scholarship for our students at all of the Nassau County Medical Society, and just steering committees, learning about different ways. I did the ACOM Osteopathic Health Policy Fellowship, which was for a mid-career physician, where I learned it was a year fellowship, where it was actually in 2019 to 2020. And I was really excited to be able to, every month over the weekend, we were supposed to be able to go to most of 10 osteopathic schools throughout the United States and be able to view them, 10 to 14, depending on your year, and also take these courses regarding health advocacy. But guess what happened that year? I was able to go to 4, but then there was the COVID pandemic. It became virtual, which did change it a little bit, but it was still a good opportunity to really learn from advocates, not only at the physician level, but at all different levels. Myself, I take care of a chronic pain population. I take care of patients who really have multiple complex medical conditions. So I take all my patients and what I experience with them with me when I do my health advocacy and think about their issues. But I'm really passionate about physician wellness, outreach to students especially, but to physicians. I was a prior program director, so I'm very well aware of the amount of time and energy goes into residency. I personally felt residency was a very challenging time for me, so I have a lot of empathy for residents. I am dealing with medical students now, which has a different connotation and also a different level of education, in that medical students are still pretty much excited about their career and just starting in it. I know once we get to residency, that's when you really get to learn about not only your importance, but how much power you have and how much responsibility there is. And I also enjoy networking both on a virtual level like this and in person. So I like to say to everyone, no matter what level you're at, you're the expert. So you could be the physician expert, you could be the resident expert, and you could be the medical student expert. And you could even be the one that tells your friends or your colleagues, hey, let's get involved in this. Let's join this society. Let's talk about this. Hey, we found this. Let's try to find a solution. Let's try to find a mentor. And so for the medical students, two of the things that I started was the Congressional Health Policy Fellowship, where this is a 2-year fellowship. And that's where right now we have 3 wonderful third-year fellows who follow me, and we get involved not only in the local, but also in the state and the national level. So many opportunities have been available by the Nassau County Medical Society for our health policy fellows. Like, for example, they've been our delegate for the Nassau County for the past 2 years, which I've been very grateful for, but also on different medical societies, different levels. And this is a great curriculum. We meet weekly. This is a hard time for them because it's during their 3rd and 4th year. So 3rd year, especially now, they're just starting their rotations. So we meet, and what we do is we decide on a topic that we want to talk about, and we try to find a bill about it, but we always just say, what is your interest? So this is the 10th year that it's been happening. And the exciting things is that we've always been able to either talk to a representative or at least keep the conversation flowing. We haven't always been able to do exactly what all the fellows would like to do, but we've really been passionate about it. And so some of the things, and I've learned from my fellows every year, because every year they have different passions. So for example, organ transplant was one of my second fellows' passion about. And they explained to me that organ transplant, when you are, let's say you decided to give your kidney to someone else, that sometimes, that they have to pay for their own medical transport and their own things. And there were so many financial barriers to it that I didn't recognize. And so we did a lot of research. We met with politicians who were interested in that. We met with some members of insurance companies to see if that could change and things like that. Another one of my fellows, I learned about the Surprise Billing Act, which was during that time it was passed. And what they did was they went to every single hospital system in Nassau County. And then we met with representatives from those areas, and we let them know that even though the Surprise Billing Act was passed, there are still some barriers to this. For example, some of the things, you're supposed to have outlined, but what is the consequence for not having all of the prices online? Also, where do you find them? It was very challenging, especially for some hospitals. Some hospitals didn't even show the prices. So their surprise billing, was what could be a surprise for our own patients. Another one of my fellows was interested in rural medicine, and with the different politicians that are in office with regards to their loan forgiveness. And that's something that all my students always have a passion about, like loan forgiveness and barriers with regards to that. Another thing is in regards to, I do 4th year elective, and that's for those who can't do the 2-year fellowship. So this is a 4th year elective, and it's a 4-week elective, and definitely more reasonable, that a lot more students advocate for it and try to do it. And I do recommend that this is done after they do their electives in their places that they really want to go to, or their VSAS. And if they decide, let's say they want to be an anesthesiologist or something, they should focus their beginning electives on that. And then, so I usually get them on the second half of the year when they're either matched already, or they know they've had their interviews, they're excited, and they're also saying, you know what, I have a little bit more free time where I could really pursue my passion for this. And during those 4 weeks, we try to get a little media training in. We try to get a resolution writing workshop in. We try to meet with one member of either assembly or something, usually virtually during this time. And we try to get research. A lot of the students, why they like to do this elective, they like to do it because they get either a poster or some kind of publication that if they haven't had their application yet, they can add it in, especially with regards to ERAS. If not, then they can just use it on their interviews. One of the things our students do are career day. We have a career day not only for the students, but also Nassau County Medical Society. We've had suture workshops. We try to go to different schools, and my fellows always go from every year from the first fellow on. It's exciting to see the fellows as they go. In fact, my first fellow ever, she came back, and I misspoke by saying it's the 10th year, it's the 8th year. 2 years before that, it was done in Arkansas. But with regards to the fellow came back, and now she's working at NYIT Comp. So it's so wonderful to see her from when she first started to now being a colleague with me, teaching with me. It's an exciting time. And that's the first time that that's happened, you know, especially at NYIT for me, being there, that I started in 2017. And it's just exciting to see all of my fellows get so successful. Now, most of my fellows are either in residency, fellowship, or out practicing. So it's an exciting time. And even in that, I want to say there's Dr. Landman. He's been an active member since day one. Was my student, did an academic fellowship, stayed on, has an interest in EDS, especially in the cardiology, but he's still a member of the Nassau County Board, and he was an active part. He did the 4-week elective. And the Pride in the Profession Scholarship, this helps because one of the things I do want to say that all of this counts is we do need funding for this. So I find grants to help our students to pay for some of their opportunities because, you know, there's limited funding in academics. And so we were lucky enough to secure the MESF grant for $20,000, a 2-year grant over that time. And that helps all of our students, especially with regards to their transportation and places when they are giving their poster presentations or their fees, if there's a conference fee or poster fees. And we're really excited about it, and we're really thankful. So I have another talk about funding options because I could go through other funding options, but those are always really important if you are going to start a curriculum, learning if your school has funding for it or if you could get some kind of grant for it. Post-COVID, there were some silver linings to these situations in that a lot of the meetings that we do have with members are virtual. They can be virtual. So that could save, if you are on a limited budget, is, you know, that could save on time and effort, but there are barriers. And the biggest barrier to getting involved in advocacy is the time, the attention, and money. Many of these medical societies do cost, a fee. I know if you're involved in academics, there's a very limited amount that you are given for your conference fees. So you are going to be paying out of pocket. A lot of times PACs are really encouraged, and the reason for PACs is that we do need to help with regards to our advocacy. And so that is something that you have to think about, that this would require some money, time, and attention. Also, your responsibilities, you have to realize, I mean, I myself don't have a family, so a blessing and a curse in that, again, I don't have children, but I know that people my age, a lot of them have young children that they have to take care of. So there is that can really interfere, because many of these events are at night or during your free time. So that is something to think about. Financially, locations, commitments, and dates. Luckily, with our Nassau County and MSNY, we're given the dates beforehand, but again, there are some sessions that I'm always disappointed that I miss, but sometimes your patient care comes first, your work comes first, et cetera, et cetera. And one thing I want to say is this Robert Wood Johnson Fellowship, what an amazing opportunity that is. We do have a New York State physician who's on it now, Dr. McNeil. He's actually from Brooklyn. After this, I mean, I'm assuming he's going to be involved in some kind of HHS committee or something. I mean, this is a one-year commitment. It's such a wonderful opportunity. And these participants have gone on, you could see a list on the website, to really improve health equity, health policy. And I mean, I'm looking at these wonderful people on the speaking protocols. If you could spend a year, and I was looking even at the funding, but I mean, it's a major commitment. It's just such an interesting thing. And it's not only for physicians, it's for, you know, they have people who are PhDs at their current cohort, they have masters, they have levels, but everywhere I go, even I had a patient recently who was, had very high graduate degrees, and they were talking about this fellowship. So it's just an amazing opportunity. And if you're really passionate about it and can spend your year, this is something to do for a mid-career physician too. So just try to get involved. Like I said, a shout out for Nassau County in October. We are having the legislative breakfast, where is a all virtual. You could do it like I do it from my office desk during the times when I can. You could try to meet with students or your residents. You could even do Zoom meetings to talk to them about health advocacy. You could try to meet with elected officials. This is a picture I took from one of our advocacy days in Albany. Again, if you're lucky enough to go in person or have the funding to bring your students to something like that. I do want to remind everyone that not only do we provide advocacy for you know, each other, but MISNY also has the Committee for Physicians Health, as well as the peer-to-peer. So these are also great organizations. Dr. Oroku had talked about in our spring 2025 sessions, which are on the MISNY WPLA website, the elevator pitch. And I like to teach my students a 2-minute elevator pitch that they can talk to themselves about, that they can introduce themselves, talk about their experience, talk about their goals, find a solution and a plan. Because when we meet with members, we're on very limited time. And sometimes when I'm saying members, I'm also saying the HLA, health legislative aides, many we've become very familiar with, and they've helped us so much. So we're very, very happy with that. And how we like to end everything is we always say, we'd like to serve as a resource for you. So let's say you see a bill in the future for chronic pain or for Ehlers-Danlos syndrome, something like that, and you say, as a politician or as an elected official, you say, you know what, I want to learn more about this. I've got this connection with Dr. Riley. I oftentimes get an email saying, hey, I just want to run something by you. Can you talk about this? So serving as a resource for your elected officials or government would be a great idea. So to work on your elevator pitch, because that's something I never liked introducing myself. And I noticed that especially when you're trying to get involved in health advocacy, you do have to, and networking, you do have to say who you are, your experience, and what you want to get out of this meeting in a short amount of time. So I do encourage you to look back on that spring 2025 elevator pitch hour, and it was a great one. One thing I want to say is if you are going to be involved in health advocacy, please know your audience. One of the things that happen in the legislative breakfasts all the time, and I meet with the students beforehand, we review everything, we go through all the things. But what I notice is if there's a bill or something that you're interested in, a lot of times they'll say, what bill, what number, you know, who supports this, who are we talking about? And sometimes they'll even correct us and say, listen, just stopping you right there. This is a great, you know, this is a great idea. These sound good, but I'm not the right person to speak to. You should really speak to the Committee of Labors, or they'll help us sometimes and talk to us, but they also will tell us if we're going in the right direction. So just prepare beforehand, just like you would do with all speeches and everything. Just know when you're going in. Like even when I go into these sessions, I always ask beforehand, what are we fighting about as especially if you're going with a group. What are we supporting? What are we against? I look up past bills. I look up who supported them. I look up where the member is that we're talking to, what they voted on in the past. So I'd be like a little bit more prepared. But I also look up what they have an interest in, what committees they on, especially if they're on health committees, and how they could help us. So kind of not only know your audience, but also prepare beforehand, which I think is just good probably for all fields. And one thing I do see it, especially with our students, but I do caution you on the use of AI if you're going to be even getting an elevator speech. There are hallucinations. So if you put into AI certain bills, just really check them. And some people, especially if you're writing briefs, people know, or they can hallucinate different bills, or they can say different things. So always, I just want to give a caution. A lot of younger people are very advanced, and this does help with writing for a lot of the things you do have to get involved in writing. And just wanted to caution you the use of AI, because sometimes they make up bills that don't even exist. So definitely double check from the in the full New York State panel, if that's what you're going to be doing through New York State, and go from there. And these are just some books that have helped me. A shout out again to Dr. Rodriguez, just meeting Dr. Shilcott and her book, Between Grit and Grace, just showing how a woman goes through life, and she really made it personal, and was being a physician, and also having a family, and everything was just really interesting. Also, mindset, I always found that really interesting as well, having a positive mindset when you're dealing with it. So instead of looking at problems, looking at it as goals. Networking, social media, that was a book that I participated in, and just a bunch of peer-reviewed articles that really can help, not only if you want to start a curriculum in health advocacy, but just in general. I thank you so much. I know I went over a little bit for your time. And if you have any questions, I'll try to see
Dr.
if there are any.
Riley, thank you for
Yes.
an outstanding speech.
Oh, thank you.
It was great to hear your journey, because I think it gave people a way to see how they could be embark on a journey and get involved. So I really enjoyed hearing you go through your journey.
Thank you.